Welcome everyone to another wonderful episode here at Jaws Podiatry. We have a very young patient who has presented to our office with a chronic ingrown toenail. Medial border left great toe. You know, just to refresh everyone's memory, the only time that I use a tourniquet is when we perform the permanent chemical matrixectomy using phenol. And that's going to be today. Again, we try the historical partial nail avulsion first. If there is a recurrence, then that's when we consider the phenol permanent chemical matrixectomy procedure. I want to be very clear. A lot of people ask me, right, on our YouTube channel, Dr. Wagner, why didn't you perform the permanent procedure? I want everyone to listen clearly. In the presence of infection, it is a contraindication to perform this procedure. Which one? The permanent procedure using, in this case, phenol. I'll say it again. In the presence of infection, no phenol. We eradicate infection first, and of course, pain. Okay, we're done. No, I'm just kidding. Okay. So what we're going to go ahead and do. Look at this on this side, Elizabeth. Yep. Look at this. Yep. Bingo. Super. So for the patient and for the entire world, right? I like to take a little bit more nail. This is what the nail's going to look like.
Okay.
You see that? And it has a very, a very natural look. It's not too thin, right?
Okay.
But most importantly, I like to perform any procedure bearing aesthetics in mind.
Thank you.
You're very welcome. So, I take my little Q-tip and we dry up all the blood because the blood may deactivate the phenol. Make sure it's nice and clean. Now I also make sure that there are no remaining nail spicules in the back. None found. Aisha. Let's close the door, please. So, I called Aisha in because the phenol, the acid is very, very strong. So, I'm very, wait, give me 1 second. I'm just very mindful, right? To make sure it is a caustic acid. You don't want to inhale this stuff. So I just called Aisha and just uncover the phenol. This is just plain old ointment, antibiotic ointment. This is to protect the skin, right? It is an acid. It will burn the skin. Ready?
Mm-hmm.
And we leave that in there for 30 seconds. And Aisha is counting. And this is extremely important to have this barrier.
Oh.
That's 1 of 3. Now we're going 2. Let's put that back where it belongs. There we go. Okay. You know, a lot of people ask me, there is an element of possible recurrence. It's a very small percent, but there is, right? 2 guarantees in life. I've added, a number 3. We know death. I hate to say that word. Taxes. Thank you very much. And Aisha, what's the third one? Guarantees. Number 3. Toenail fungus.
Oh my God. In Florida, yes.
I speak the truth. Toenail fungus, it's true. Toenail fungus will never go away. This is 3 out of 3. Three out of 3, I mean the third application of the third. Third application. So Aisha has already covered the phenol. And we're all done. So now what we do is I remove the antibiotic ointment, and Aisha has already have a little bit of just rubbing alcohol. And we do this just to make sure we deactivate any of the phenol that has, you see? I want everyone to take a look at this. You see how it's white? That's burning. That's the reaction. So we have to be very, very careful with this stuff. I think there's definitely a time and a place. Okay, we're all set there. Beauty. A little goo, magoo. Let me tell you, you've been a team player here today. Thank you so much for all your help.
You're very welcome.
Scissor? Oh, never mind. We're good. I've never done this bandage ever. I think this procedure is overutilized for several reasons, which they're very unfortunate. I may leave these reasons for another video. I think the permanent procedures are overutilized. think there's a time and a place, but a lot of clinicians, physicians, doctors, they jump at it quickly first time. There is no need. I would say 85% of the patients that come to see us here at Jaws Podiatry, we treat them more on the conservative side, using just a normal partial nail avulsion to eradicate infection and pain. We don't jump at the permanent. Personally, I'm not a permanent type of guy. I like, I don't like anything that's permanent. I just don't. So this is a perfect example of, the right indication.
Yeah, because third time.
Right, exactly. It's a chronic issue. It's a chronic problem. So we have to assess, address, and correct the problem.
Yeah.